Now we will continue with segment 3, the final segment, and it centers around education. And our next speaker and final speaker for today is Dorothy Alexander, RN. And Dorothy is from Memphis, and she began her career in nursing while she was in high school and graduated as a licensed practice nurse in 1993. And she worked for internist Dr. William Faulkner, and then she started her career in nephrology and with Dr. Hugh Williams, who retired. And she continued her career in nephrology under Kidney Care Consultants. And she's a member of the American Nephrology Nurse Association. I present to you Dorothy Alexander, RN.
Good morning, everybody. And I want to thank Pat for inviting me to speak. And I am an RN by practice, but I do practice as a nurse practitioner. So that is my practice, a nurse practitioner. And I do work with the kidney care consultant, and we see the kidney patients. And I round in dialysis unit because my patients are mostly on dialysis. Multiple myeloma is one of the diseases that we do see our patients in. And usually when they come, they are complaining, of the weight loss, and they're complaining of bone pain, and they are very anemic. But we look at it because most kidney patients, those are the symptoms that they present as well. They are anemic because the kidneys are not functional like they should be and all of that. So we do, look at them about that. Now, when they present to us, we do a battery of tests on them, and one do include specifically the SPEP, which is the serum protein electrophoresis. And we check that because there can be other causes of kidney failure other than the main two causes is hypertension and diabetes. But we do look at this because that also can be one of the main causes of the kidney failure. So when that particular test comes back, usually it'll come back like monoclonal gammopathy or increased spikes. And so what we do then is we refer those patients to like Dr. Johnson so that they can do additional battery tests. It's important that the primary care doctor get these patients to us as soon as possible because they may not think about ordering this SPEP test on them because they just look at the creatinine level and say, hey, this creatinine level is high. The creatinine level is what we do look at to see if patients are going into kidney failure, having some kidney problem. And when it be abnormal, the normal creatinine level is 0.5 to maybe 1. So when it elevates a little bit, like 1.2, 1.3, then that's when the primary care doctors might start sending them over to us. And then that's when we do test them. And like I say, that SPEP is a part of our testing. And if it's abnormal, that's where that patient will go, referred over to like someone like Dr. Johnson to continue their tests. Now, they continue to come back to us, and we're just monitoring their kidney function to make sure, everything is okay. We try to postpone their dialysis as long as possible. We may start them on like medications to kind of prolong the progress because the protein is what's causing the kidneys to fail, and that is what's going on with multiple myeloma, is that abnormal level of the protein that's in the bloodstream is also in the urine, and so it also obstructs the tubules and the filtering of the kidneys to get the protein and stuff out of the body. And so we try to prolong trying to put them on dialysis, but eventually some of them do progress to dialysis, and then we'll treat them like that. Now, I do have a lot of our dialysis patients, like I said, and they are complaining of bone pain, and they're anemic because that's a natural process of kidney disease, it's anemia, and fatigue, because their anemia process will make them feel very tired. But I'm going to, with my patients now, they're still complaining, and they're complaining, so I'm going to develop a plan whereby, you know, if they complain a lot, I'm going to go ahead on and test them for just draw the SPEP, just to see if something has also popped up from the time that they started dialysis. Because it may be negative at that time, but we don't know what is going on now. And then in the process with them complaining, we just may think that it's just going on with their kidneys. That's the process that happened with the kidney. The bone's gonna hurt because, you know, the phosphorus is coming up out the bone and the calcium. And so, but now, you know, I'm thinking that it could be something more going on, and then I go ahead and start testing my patients a little bit more now to see if something else is going on, and then we'll get them into Dr. Johnson as soon as possible. Okay, is there any questions on?
Dr. Johnson's wrap up. Thank you.
So I guess I was just supposed to talk about resources.
Yeah.
And there's some over here. How many of y'all get on the internet? There's a whole bunch in my slideshow. I had a list of web pages, but there's Myeloma Foundation. If you just myeloma.org, there's several. If you just search for patient assistance or patient information in myeloma, you know, pages and pages of things will show up. But the best resource should be your doctor. Your doctor needs to get you into somebody who knows what they're doing, and then they will see what's available in that neighborhood. The Leukemia and Lymphoma Foundation will often help with treatments and with information, the American Cancer Society. So there's lots of information that's available. You just have to reach out and start asking for it. But you have to know what you're asking for. So that's why it starts with getting a diagnosis. And that means, you know, seeing your doctor when you're sick and figuring out what the problem is. And you can tell, like he said, when you first hear this, your brain stops. You get vapor lock, and you can't let it sink in. So you're not in a situation to absorb information. So it's important to bring another brain with you, like your lovely wife, or you know, friends, somebody to help take notes and help keep track of this, and bring somebody when you come back with questions, because again, it's terrifying. And when your heart is stopped, your brain stops. You know, you just can't think what questions to ask. So just keep asking, keep thinking, but there's a lot we can do, and there's a lot of help that's available. I had mentioned the cost of the drugs, and nearly every drug company has an assistance program, a way to help get the drugs paid for, because they know they cost a fortune. To develop and get a drug approved costs billions and billions of dollars to get them through all the hurdles. So the drugs are just not cheap to make and design. Even if it's a little small molecule, it costs a fortune. So, but there's assistance available.
Thank you. Thank you. Give all our speakers a really big hand. Thank you so much, all of you. Thank you, all of you. Now, we're going to do some Q&A, and it doesn't stop the Q&A, because the Q&A is really important. So I want everyone asking some kind of question. In the meantime, see those beautiful kits there? When you finish your survey packet and your call to action, hold it in the air, and one of our volunteers will come by and give you your gift kit, okay? Everybody got that? We need all of the surveys completed. Okay, so now we can start the question and answer. You can ask questions of any of the people here at the panel.
Or they could walk up and ask questions.
Yeah, or you can walk up, Dr. Stunt, you can walk up and ask a question if you want, or stand and ask one. Does anybody have any?
Yes, ma'am.
So with that initial symptom you usually get, does it come and it goes, or does it just stay?
No, they'll come and go. You know, you'll have everything in life, you have good days and bad days. And I tell people, it's like standing at the beach. You know, the waves come in and the waves go out. So all your symptoms will go back and forth. But are they building up? Is the tide coming in? Are they getting worse? Then you need to see somebody. But if you move the couch and your back hurts, you move the couch. But if 2 days later it's still hurting, well, then maybe something's going on. So, you can have everyday aches and pains, but if they grow and build and keep going, then that's of concern. But everybody has good days and bad days.
I don't have a question per se, but I did want to bring out something. You all may know a lady politician named Judy Ferraro. She was a Congress person from the state, and she was the vice president candidate for Walter Mondale back in 1884. She also had multiple myeloma. I think she passed away like in 2009, but she was very instrumental in Congress to get a whole lot of those multiple myeloma treatment. Me and quite a few of us lobbied through Congress, and as a result of that, I'm probably allowed to say because of her. So I don't know if many of y'all remember Judy Ferraro, but she played a very important role in a lot of Congress for those treatment plans.
Was that all the questions and answers? Okay, what I'd like to know is how many people in the audience are cancer survivors? Stand up. Be proud you have survived. Give them all a hand. Everybody, give them all a hand. And there's one other lady who is a multiple myeloma survivor, Margaret Williams. Margaret, can you come to the mic just for like 2 minutes and talk a little bit about how you found out you had multiple myeloma? And in the meantime, you guys get those surveys done. Come on around, sweetie.
Hello, my name is Margaret Williams, and I am a member here at Brown, and I am a 2-time multiple myeloma survivor. I came down with myeloma in 2012, and I've gone to the doctors, and they've taken the MRI and CAT scan. It kind of went over their head because my protein was off the chart, and my anemia, I was anemia. So the doctor, she wasn't too sure what was going on. So she said, well, I'll send you to a neurologist. And she said, we'll probably get to the bottom of it. So she sent me over to a neurologist, and it didn't take him 10 minutes to find out what was wrong with me, give me a blood test. And then we were on our way to celebrate in New Orleans because it was almost New Year's. And all of my family was home, and they telling me something about some cancer. Oh man, what's going on here? So I looked at my husband, he looked at me, and I never broke down and cried, but I felt so bad. But at that time, y'all just won't believe this, a coming spirit just went all over my body. And I just let it go. I never cried. Woof, to this day, I never cried. Never cried, why me, why me? I ask God all the time, why not me?
That's right.
Because if he give it, he can take it.
Yeah.
But I went on to, they sent me to Dr. Ben, and she was not a myeloma doctor, she was a breast cancer doctor. But she told me, she said, your insurance is going to send you to Vanderbilt. But she says, I have this man up at Methodist. She said, I'm going to send you up there to the West Clinic to see Dr. Johnson. And sure enough, I went up to see him, and then we found out that that's where TRICARE was sending me to Vanderbilt. So as of this day, I've had 2 stem cell transplants. I'm healed, and I thank God for bringing me this earth He brought me, and I just say thank you.
Thank you so much. You're such a sweetheart. You see these wonderful people of God, all of them who are surviving multiple myeloma. And this is what I think Dr. Johnson and Mary Jerome has been talking about. We can catch this in time, but we have to be aware. And what I'd like for each of us to do is make contact with these patients and these doctors and these nurses that are on the panel. Because what we want to do, as I said earlier, in about 30 to 60 days, how many of you signed the call to action? Did any of you sign the call? Perfect, that's good. We usually get about 10 to 15% of that. What we want to do, especially if you folks sign the call to action, we want you to make contact with these individuals before you leave here. Because in 30 to 60 days, we're gonna call and say, hey, Betty, did you ever use Sterling? Or did you ever use Larry? Or did you call Dr. Johnson? Or did you call Dorothy? Have they been out to talk a little bit about multiple myeloma for your sorority or your church or your group or whatever? We really want this to happen, because remember, we're comparing you guys side by side with Oakland, California and Washington, D.C. And all three of our comparisons will go into getting us a grant next year, which means we could be back here even bigger and better because of you, because you have carried the message. You have made this outreach work. And I know that Danita is all over this. I know Pastor Orr is all over this. So we want you guys, when we call you, let's be ready. Let's get ready to make this work for us, okay? Can I get an amen? All right. Now, who is not done with their surveys? Because we want everybody in the room to have a gift bag, but we mostly, in order to get our funding next year, we got to have those survey packets back, completed, okay? So raise them in the air when you're done. Now, you have all the experts you need right here. Can I believe that nobody has any questions for these folks? Just one or two more questions? How many of you have some of the symptoms? I know this lady's talked about it. The back pain, the kidney. Anybody have any of the symptoms? I mean, anemia, feeling tired. Dr. Johnson talked about that. Okay, come on, Dr. Johnson. Here's your expert right here.
Yes, sir.
I'm going to say, as I shared with Dr. Hightower sitting here, my soror, I said, I was getting ready to leave because I'm supposed to be in church at a meeting.
This is church.
But my daughter has had many of the symptoms that you talked about. She's only 33 years old, and we've been trying to figure out what's going on with her back. So I said, oh my God, maybe this is where I was supposed to be. So for me, I think the next question would be to ask the doctor to check for this. So that's the reason why I'm here still.
Okay. Good for her.
I have one question, Dr. Johnson. I know you talk about the patients and all the treatment and everything. Is there any advice for those family members that have to care for these patients that has to be by their side? When you talk about, volunteering to take them to the doctor, go through that process. So is there any advice you would give to the family or caregivers?
The thing that upsets me sometimes about family members is the patient won't feel good. It hurts to get out of bed, or they're just not hungry. And usually it's the wife who will say, well, if he would just get out of bed and eat, he'd feel better. And I say, if he felt better, he'd get out of bed and eat. So let them not feel good. You want to be a cheerleader and encourage them, but not nag them or push them. Because just about everybody wants to do as much as they can, and if they can't do it, don't push them too much. I guess that's the thing I see the most.
Before we go any further on that question that was asked, how do you take care for the caregiver? I think we have several experts in here.
Two of them.
Two of them, but this is an expert right here. I can tell by the way she was smiling, and your husband looked over here and said, can you give them some advice?
It's challenging. Lots of prayer. And as he said, not nag. It's hard not to nag because you want them to come on. And I'll just be transparent. Quit being a punk. Like, come on. Come on. And with mine, he would say, after transplant, we were to walk, and he didn't feel like walking. And I'm like, just a little bit. I don't feel like walking. Well, you have to walk because you can't get a blood clot. You do have to kind of allow them to go through the process and just be there.
Thank you.
We have one more expert.
Caregiver.
Thank you, Beth.
Yes,
Caregiver.
caregiver expert for Sterling Williams. Basically, I just had to be real supportive of him. And he had a problem with the walking as well. He actually walked when he first got diagnosed like a snail. And I had to take him over to the park and walk with him and encourage him. And he wanted to keep working. And he kept working, kept going to work. And I kept encouraging him, maybe you need to slow down and not go to work. But that was therapeutic to him to keep working. So I just mainly prayed and supported him, and my daughter helped as well. She was involved in the care as well. And we pushed through, and we just, like I said, we just kept praying that he would get better. And he did get better. So we were happy about that.
Thank you.
At this time, we're going to present the awards to our speakers. Danita Brown. If you line up here, line up here. Brown Missionary Baptist Church. Danita again. Birth of Fame. Dorothy Alexander. Sterling Williams. Dr. Johnson. Larry McGarity. Margaret Williams.
And he's standing in for Pastor Mr. Ruckers. Dr. Hightower has brought her students in from Southwest College. They have been downstairs directing everybody up here. They came to breast cancer, cancer awareness month here at Brown.
Beautiful people, good morning. I want to thank everyone. This is absolutely fabulous. Southwest Tennessee Community College has just been blessed to pair with this awesome, beautiful person. On behalf of Alpha, Kappa Alpha, Sorority Incorporated, we would like to give to the Brown Baptist Cancer Ministry this $200 that's like $2,000, maybe that $2 billion that one thing we all trying to get. So with our heart and warm felt, thank you for allowing us to be a part of this, Ms. Brown. And to all my beautiful survivors out there, to all my caregivers, to all the ones getting that word out, you are the real heroes and the she-ros. And for this church, they always give into the community. That's what this church is about, that. And knowledge is power, y'all. So each one of us got to get out here and spread this word about multiple myeloma. Thank you so much just for letting us be a part of it.
Thank you.
Love you, Ms. Brown. Love you.